Hi there, my viewers. I welcome you to Excel Health Arena, and we've been talking about family planning, talking about permanent method of family planning, and I started with male sterilization. So I was talking about um, the the fact that a man needs to take about 20 ejaculations after the procedure is done, which will take about 3 months before the person can assume that he may not be able to impregnate a woman again. And for men, the male sterilization is a little bit reversible, possibly reversible in the sense that they will also open up the vas deferens to see if they could connect the vas deferens, the tubes, back. Okay, but as much as that is possible for them to for doctors to do, it is also to be noted that recovery rate after the procedure reduces. It drops. Recovery rate after the procedure reduces, and particularly anytime after about 7 years that the procedure has been done, it may not really be reversible again. Okay, so it's not so reliable when it comes to reversibility. Let's take note of that, even though it is still somehow reversible. Now, there are some things that we need to note. If those things happen or are present in a man, you will want to consider delaying that procedure or suspending that procedure for the meantime. You won't want to do it. Okay, if the patient has scrotal skin infection, the skin of the scrotum, if it is infected, for whatever reason, it needs to be treated. So you have to delay that kind of procedure because it will complicate it. Infection on the skin, on the scrotal skin, will complicate it. So avoid it. If there is infection of the epididymis or orchitis, that is, if there is also inflammation of the scrotum or the testes, inflammation of the testes or the scrotum, you will want to delay it and treat that before you go ahead with such a procedure because it can be complicated. If there is psychosexual disorder, you need to hold on and treat any condition that may want to complicate that situation if you go ahead with it. So if there is scrotal mass or tumor or mass of the scrotum, if there is coagulation disorder, the person, there may be uncontrolled bleeding after the procedure, or in the procedure and after the procedure. So for that reason, you want to exercise caution with that. If there is active sexually transmitted infections, you want to exercise caution with that. So for these reasons, you would want to suspend that kind of procedure for any man until those things are taken care of before you can go ahead and do it. So I don't want to really talk about the procedure. It's a simple procedure actually, but I don't want to talk about it because it's not really going to be that understandable, sort of. Conventionally, they can use scalpel. They may use other, they can use scalpel, and conventionally they can use, other means rather than scalpel. They won't use blade. What I mean by scalpel is blade. So they'll palpate the vas deferens. That's the tube that they want to cut and ligate. They will grab it. Once it is grabbed with forceps, then they will pull loop. They will pull the loop of the vas deferens and they will remove the segment. Then when they remove the segment of it, they ligate both ends and cut in between. Now, when they cut, before they cut, they ligate the first side, ligate the second side, they stitch. So after that, they are able to now cut and to make sure there is no bleeding, and they secure the dressing, and it heals up after a few days, and for 3 months the man is good to go with condom as a supportive method of contraception, with about 20 ejaculations before he can be sure that he will not be able to impregnate a woman. So after surgery, there may be need for some painkillers because there could be some pain. Then antibiotics may not necessarily be needed except there is another reason why antibiotics will be needed. But generally, it's a procedure that may not require antibiotics after the procedure. The dressing will be there and it will heal after a few days, just 1 or 2 days. Everything is fine. Then there may be the need for scrotal support, because the scrotum could be inflamed a little bit, only heavy, it could be a little bit painful, so there could be need to pack the scrotum with some support, maybe cotton wool and gauze, suspend it in a way that it will not be too heavy and the man will not be feeling the weight and the pain after the procedure, and that will take about 1 or 2 days, after which he will be fine. So cycling, exercises that could bring pain, that could worsen it, that could complicate injuries and all that, should be avoided in the course of healing. After some time, the man gets back on his feet to do everything he's been doing even before he had the procedure, so that's fine. Then benefits of vasectomy as a method of family planning, like we said. Before I go to that, I also want to note that a man, like I said, needs to wait for 3 months at least. And with 20 ejaculations, I've said it before, I want to say it at this point because I'm rounding up that procedure. So that's why I want to also talk about it again. It's important. So the man should note that he can still get pregnant. He can still impregnate. So for that reason, he needs to take another method, maybe like a barrier method. He needs to use condom for the period of time if he does not want to impregnate a woman. Okay, so now the benefits: failure rate is just less than 1%. So that means it is more than 99% effective. And the 1% or less than 1% failure can be due to, unprotected intercourse within the period that there is still remnant of sperm along the tube. That is why it is expected that the man will have about 20 ejaculations minimum after the procedure before he can assume that he cannot impregnate a woman again. So please, let's take note of that. Then, if in the course of the surgery there is an error such that the surgeon is not able to occlude the tube very well, in a situation like that, even though that is a human error, it is very, very rare, but it is still a possibility. So let us note that can also occur. And yeah, so complications of vasectomy can be testicular pain in the testes. Like I've said it earlier. Scrotum also could be painful, which could last for months. The body is adjusting because now sperm is being produced, but is not being ejaculated. So in a situation like this, there will be a little bit of engorgement of the scrotum for months before the body will get used to it. So when sperm is produced, it is reabsorbed into the body. Normally it is supposed to be ejaculated, but for the fact that the way so because the bridge has already been separated, for that reason the sperm cannot pass again. So the sperm needs to be reabsorbed, but pending the time the body gets used to it and it gets absorbed and all that, it may engorge. Engorgement means it will something that ordinarily is supposed to be flowing out. If it's not flowing out, it will make it a little bit inflamed, or a little bit big, or bigger than necessary, or bigger than the usual rather. So somehow the body finds it difficult to adjust initially to the fact that is not leaving the scrotum, is not leaving the testes. the